I recall a few years ago now, I participated in storytelling program, and I was asked by one of the lead mentor facilitator for the session, asked the question, what does it mean to feel whole, to feel
Mm,
well, and to be in just relationship with yourself and others? That was the entire purpose of this particular program. And mind you, at this point, I've spent a lot of time reflecting on those questions without necessarily phrasing them in that particular way. But what I can tell you is that what emerged for me and what was reaffirmed, because I feel like I had already articulated this, yet I realized in a profoundly deeply way that I would have to continue to practice these, is that my external systems work requires internal systems work. In other words, that if I'm going to seek to change any of these narratives, right, any of these isms and phobias externally through my narrative change strategy, through my storytelling, I have to do the work of shifting those narratives internally as well.
yeah.
And I'm not going to get into the nuance right now of thinking through, is this a chicken and egg situation? Which one goes first? We need to do both things, right? We need to move in a flow between working externally and internally. And the external work will support our internal work, and most certainly the internal work will support the external work. The one thing that I will say, though, is that too often what I see organizations and systems do is completely externalize this work. So I would say about 90% of the time, and this is just me on the spot reflecting on this, about 90% of the time, when I'm engaging with large systems, that is the ask. Help us figure this out externally. They are eager, ready, and willing to tell the story externally, but there's tons of barriers and hesitation to do any of the internal work. And I ask then critically, what happens when the external narrative is in dissonance with internal narrative? Misalignment, right? There's no wholeness, there's no wellness, there's no just relationship. So this is where transactional storytelling happens. This is where telling that gets standing ovation, right? And maybe brings in the dollars, right? And the funding also perpetuates harm and also perpetuates inequity and also, right, perpetuates these practices that are extremely harmful to our long-term work of building relationships, building trust, building solidarity, building community. So there has to be an alignment there that I think we continue to struggle with. These questions that allow me to, and by the way, which I don't have answers to any of them, I have an ongoing process of me seeking wholeness, of me seeking wellness, of me seeking just relationship with myself. I think we need to think of those questions collectively as well. What does it mean for us to think of ourselves as part of a whole, right? What does it mean for us to be well, not
Mm,
just individually, but as a society? And that's not how our systems think. That's not how our healthcare system was designed to work. We are not diagnosing, although I would say there's definitely research. I don't want to say that there's a complete absence of dialogue around this. My critique is towards how our healthcare system works, right? And by default, many other systems, our education system works. We see individual students, we create individual students. We are not thinking about the quality of a learning community, although too often that is where precisely some of the issues that we need to tackle exist in the collective. And we need to think about what does it mean for us to have justice to ourselves, to each other. Stories that allow us to pursue not complete answers, because I think I don't believe in absolute answers. I believe in the process of us seeking what it means to do this. All seeking stories that move us in that direction is the type of narrative work that would allow us to reimagine what these new ways of being, right? New structures, new ways of relating to each other, new systems can help us achieve health equity.